Knock, knock.
Come in.
Hi, I'm Lindsay. I'm your student nurse. Today I'm going to be doing the ears, nose, and throat exam. I just did my hand hygiene. I'm ready to go. Do you have any difficulty hearing?
No.
Any discharge out of the mouth?
No.
Any discharge out of the ears?
No.
Any history of hearing loss?
None.
Any ear infections or trouble with sense of smell?
No.
Any sinus problems or allergies?
No.
Have you ever been diagnosed with a deviated septum?
No.
Good. Do you have any painful swallowing?
No.
Do you have all your own teeth?
No.
Okay. Do you have any bad breath?
No.
Do you have any pain or lesions on your tongue or the back of your throat?
No.
Perfect. So first I'm going to do the ears, and I'm going to be looking for lesions, swelling, drainage, any skin marks behind the ears,
Mm-hmm.
and I'm going to look at the pinna. So here I'm looking at the right ear. No lesions, no skin discoloration, no markings that look like skin cancer. And look on this side. No lesions, no unusual skin color, no swelling, no discharge out of both ears. Looks good.
Good.
Next I'm going to palpate the ears and let me know if you have any pain or tenderness. Any pain or
No.
tenderness?
No pain.
And on the top,
No.
any pain or tenderness?
No.
Perfect. The ears are symmetrical they line up nicely with your eyes out the outer campus, which is great. So now I'm going to press on the tragus actually, which is on here on the top. Pain or tenderness?
No.
Perfect. So now I'm going to do the whisper test, and I'm going to whisper a two-syllable word on each ear. I'm going to have you cover the other ear.
Okay.
So cover your left ear.
Okay.
Now say it out loud.
Baseball.
Yep, cover the other ear.
Football.
Yes. Great. So the whisper test was good bilaterally. And now I'm going to do the tuning fork. So I'm going to activate it, and I'm going to hold it up. First I'm going to do the Weber test. And this is to test for unilateral deafness. And I'm going to hold it on the top of your head, and you should hear the vibration in both your ears.
Okay.
So once I activate it, let me know if you hear it.
Yes.
Do you hear it in both ears?
Yes.
Perfect. That is great. Hearing is good bilaterally. No deafness. Next, I'm going to do the rhini test with the mastoid process behind the ear. So again, I'm going to activate it, and then I'm going to hold it up to the mastoid process, and you can let me know when you hear it and then when you stop hearing it.
Okay.
Activated.
I hear it.
Okay, and when you don't hear it.
Don't hear it.
Now let me know when you hear it.
I hear it.
Now when you don't hear it.
I don't hear it.
Great. Now I'm going to do the other side. Activate it. Here up against the mastoid process. Let me know when you hear it.
I hear it.
When you don't hear it,
I don't hear it.
hold it up. Let me know when you hear
I
it.
hear it.
When you don't hear it.
Don't hear it.
Perfect. So the tuning fork test is to test for your hearing for sensitivity, and the Weber test was great, and the rhini test was great, and that also tests the air conduction and the bone conduction. So the air conduction was, and the bone conduction was a 2-to-1 ratio. Next, I'm going to use the otoscope, and I'm going to pretend I have one with my pen light.
Mm-hmm.
So first I'm going to turn the light on the otoscope. I'm going to take a cover, if I had a cover, I'm going to put it on the tip and turn it clockwise, making sure that it's nice and tight. Then I'm going to pull the ear back and hold it for traction. That is going to straighten the external canal. So I'm holding it back, straightening it, and then I'm going to first look to make sure the ear is clear with no foreign bodies before I put the scope in. Great, don't see any foreign bodies. And then I'm going to gently insert and And then I'm going to look through the magnifier for the external portion. And here I can see some cilia and some small amount of earwax, which is normal. And then I'm going to insert further with the otoscope. And I'm going to go further to see the tympanic membrane, which is a nice pearly gray color. And it is intact above the the malleus, and it's retracted over the malleus. As I'm looking, I don't see any lesions or any drainage. I'm going to do the same thing on this side. Oh, sorry. I'm going to lift the ear up, pull it back to straighten the canal. I'm going to look, make sure there's nothing in there blocking anything. Insert gently. I'm looking for cilia and any earwax. I don't see anything, nothing unusual. And then I'm going to insert a little bit further, and here I'm looking for the tympanic membrane. And it is slightly over the malleus, and the light retraction is good. And it is a light gray color, which is perfect.
Beautiful.
Next, I'm going to do the nose inspection. And first I'm looking at you symmetrically you are symmetric. I'm looking for any lesions or asymmetry. Your nares are symmetrical. I'm looking for any discharge or lesions on top of the nose. I don't see anything unusual. Now I'm going to palpate for any pain or tenderness.
No.
Any pain or tenderness?
No.
Perfect. Now I'm going to check your patency. So if you could just close one nostril at a time and then give a little light blow. Great. Other side. Good. Very good. So there's equal airflow symmetrically, which is great. That means there's nothing blocking either side. Next, I'm going to look into your mouth, and I'm going to see. First, I'm looking on the outside, actually, to make sure the smile on the outside is symmetrical, making sure that you have no lesions on the outside, no canker sores, no cuts, no unusual coloring, no cold sores. So if you could just smile with your teeth. Great. That looks intact. All your teeth look intact. You have no drooping. Your gingival looks good. Now I'm going to look in the mouth. And I'm going to have my little light here. I'm going to have you open up all the way. Say, ah. Great. Palate looks good. Great. Awesome. So under the tongue, the frenulum looks good. It's side to side, looks good. When she said, the uvula was midline, there was no edema, no drainage, and no cobblestone in the back of the throat, which is great. I'm going to look again at the parietal gland, which is the second top molar. You just open. Great. Okay. You can close your mouth. The parietal gland looked great. It's in good condition. No extra drainage there or any unusual coloring. And the soft and hard palate and the mucosa looked good. No dental decay that I saw. And that's it. Thank you.
Thank you.